Rest and nutritious foods. Resting and eating nutritious foods are essential for optimal healing. Soft foods are best to avoid injury to the surgical site. Try to keep food away from the surgical site. High-calorie and high-protein foods are ideal for the first few days. Drink extra non-carbonated fluids to avoid dehydration, especially the day of your surgery. Do not use a straw for 72 hours. Avoid eating hot foods while your mouth is still numb to avoid burns. Bleeding. A gauze bandage will have been placed by the surgery team. Leave this in place for about 10 minutes and then remove and discard. It is expected that a wound in the mouth will ooze small amounts of blood for 12 to 24 hours, which will make your saliva red tinged in color. Gauze should not be replaced unless you experience active bleeding, which will be evident by blood clots forming in your mouth. If this should occur, rinse your mouth gently with ice water and then place a new gauze, moistened with water, over the area of bleeding and apply continuous pressure by biting down gently for 10 minutes. Control your pain. Pain is controlled best when pain medicine is taken prior to the local anesthesia wearing off. Take medication as prescribed the first day every 4 to 6 hours.
No pain medicine entirely removes your pain sensation, but it will lessen it to be more tolerable.
If adequate pain control isn't obtained, please call us. Narcotics. You may be prescribed narcotic pain medication. Always eat something prior to taking the narcotic medication. You may use ibuprofen as a second pain medicine with your narcotic. Follow the ibuprofen label directions. Do not take additional Tylenol, acetaminophen, as it is included in the narcotic medication.
You should discontinue the use of the narcotic medication as soon as your pain can be controlled with over-the-counter medications.
Any unused narcotic medication should be appropriately discarded as soon as possible. Store all narcotic medications in a secure location.
Over-the-counter medication. You may be advised to take only over-the-counter pain medicine, such as ibuprofen or acetaminophen. Please follow the label directions.
Swelling.
Keep your head elevated when laying down or sleeping, head above heart. This will help minimize your swelling from the surgery. Swelling will be proportionate to your surgery. For example, a bigger surgery will cause bigger swelling. It will be at its greatest extent on the 3rd and 4th day after surgery. Cleaning your mouth.
Keep your fingers and tongue away from the surgical area. Routine oral hygiene may begin the morning after your surgery. Gently clean your teeth with a soft bristled toothbrush and toothpaste. Do not brush the surgical site, only the teeth next to it. You should be very gentle but thorough on the teeth next to the surgical site. Avoid ultrasonic or power brushes for the first week after surgery. Sutures, if placed, will usually dissolve after 7 to 10 days. Antibiotic mouth rinse. If you are prescribed chlorhexidine gluconate, commonly called Paradex, you should begin using it the morning after surgery following gently cleaning your teeth. Very gently rinse it around your mouth and spit it out carefully. This will need to be done each morning and at bedtime for 7 to 10 days. Never rinse your mouth with hydrogen peroxide.